Hello, everyone. Thank you for joining us. My name is Bruno, Vinay, and I'm happy to welcome you on the behalf of the Sparknews team. So this webinar, on the impact of COVID on women is the first of a series of 4 on gender equality. And it's especially tailored for you journalists around the world. So just for you to know, Sparknews is a French-based social enterprise working with leading media across the world on changing the narrative on today's major global issues along the lines with the SDGs, the Sustainable Development Goals defined by the United Nations. So I guess you are attending today because you are convinced that journalists play an essential role in how challenges that women are facing are represented. The plan with our webinars is to share with you some inspirational stories to fuel your thoughts on the topic. We know that you've been writing on these things already, and I'm sure you are pretty much committed on these things. But we thought that it would be great for you to meet a couple of genuine players and who are very much committed to make a change in the way people look at gender equality. And actually, I want to thank them in advance for allocating some time to debate with us. Of course, feel free all along these 8-ish minutes to ask your question and address your concerns on the chat and questions sections. Of course, vote the questions you think are the most relevant. We want this webinar to be full-on interactive. So we've got a team here, Alisa, Flo, to really be sure that this webinar is going to be interactive. So please, we want to make sure this really happens. So please don't hesitate to ask your question and address your points. After the roundtable, please stay with us because we'll have the opportunity to meet with 4 inspiring entrepreneurs. They are tackling gender inequality, they are championing the work of women in their communities, and you're going to have the chance to really talk to them and have a possibility to discuss and ask direct questions to each of them. But now to introduce all speakers and moderate our conversation for the next 30 minutes, I am very proud to present you Alexandra Topping. Alexandra, are you with me?
Yes, hi Bruno.
Hi Alexandra. So Alexandra, do you mind if I call you Lexi?
I'd be delighted.
Okay, so welcome Lexi. Alexandra, hello. Here I am again. Is Alexandra, is Lexi, are you with us?
Hi Bruno, sorry I lost you.
Yeah, sorry. We apparently we've got a couple of problem issues here, but I'm sure it's gonna be fine. Sorry.
Webinar.
Please be nice with us, everyone, because I know that you know what it is to organize this sort of webinar, and when the technique is not really there, it's a nightmare. But we'll get there. Anyway. So Lexi, I was saying you are a senior news reporter at The Guardian, and you are a key specialist in gender issues and equality. So I'm very, very happy that you made it to moderate this roundtable, and you're going to be all along with us and have a couple of wrap-up words at the end of this webinar. So thank you again. And I would start with a question for you, Lexi.
Sure.
How is the COVID affecting your everyday life as a citizen and as a journalist?
Well, wow, that's a big question. It has been quite a ride. I think for, every single individual in the world, the past 6 months have just been absolutely crazy, and we have all been struggling with a new reality which happened, so very quickly. So I think for everybody, it's been intense. But as a journalist, and for the journalists who are with us today, will know that there's been particular challenges being a journalist at this time. I mean, we really have been living it breath by breath, sentence by sentence. On some days, I've been running the live blog, and you're literally bringing all of the news from coronavirus, all from across the world, and from your different correspondents, and also, playing your own role. So it has been very intense. It has been long hours. It has been, I mean, I can't tell a lie, it's been very draining. At times there has been, we've felt under a lot of mental pressure. And of course, we're dealing with this all at home. So we have the same technical challenges that we've all faced. We are not meeting up with our contacts. We're not, you know, during lockdown, we had a policy of if, you know, that we weren't going out on jobs, you know, to meet people in any way. It's not like you could stop people in the street because nobody was there. So we've had to find new ways of connecting with people and new ways of enlivening our stories, which we would usually do by getting out there and meeting people. So that has been a real challenge. Despite its limitations, you know, using Zoom and Teams has been a lifesaver for me and my work, because, you know, I find it's great to talk to contacts, be actually able to see them and interact. But, you know, you asked us, how have I dealt with it as an individual as well? Well, you know, we have been in the most intense period I've ever experienced in my career, and I can't imagine anything could match this. At the same time as both of my children suddenly were not at childcare. And I have a daughter of 1.5 and a son of 4.5. So they are, you know, they can't be left to their own devices because they will find multiple ways to kill themselves a day. And so it's been a real challenge. I'm very lucky that my partner is very supportive, and we have, you know, just really try to split everything as evenly as possible. So that's meant me starting very early in the morning, him looking after the children, and then me stopping, immediately going into childcare. But of course, you know, news doesn't always work like that. You know, news just happens when news happens. So he has had to take, you know, fortunately in some ways, some of his work reduced because of the lockdown. So I'm lucky that I have a supportive partner who bore the brunt, truly.
Yeah, so I would say I like to hear what you say, Lexi, because it means that this gender equality thing, we need to be men and women pretty full on this. And as what you say about the COVID, I mean, your partner played the game, and we definitely need to play the game all together on this, don't you think?
I mean, absolutely. There is no way of getting through this unless we work together. It's just, it's impossible. So, you know, I did a lot of work before we had children, making sure that the groundwork was there. We've always been very open about our debate about how childcare would be evenly distributed. At the moment, he's certainly doing more than me, so I'm not really holding up my end of the bargain at the moment. But yeah, I mean, I think one of the real positives of this situation is that even though we know women have been doing more of the childcare, we also know that men have been doing more childcare, full stop, you know, spending more time with their children. And that has to be a positive. I mean, personally for me, I'm spending at least 2 extra hours a day with my children that I wouldn't because I would be commuting. That's a day a week, which is a big deal. And I think it's really given me a new perspective on how important the work that I do is. The work that I do, general reporting, because, you know, we're living through such momentous times, but also the work I do in gender equality, because I genuinely think that we are living at a moment of a second crisis, and that is a crisis in gender equality. And unless journalists throughout the globe make sure that we retain our focus on that. And it's very easy to get lost at the moment. There's an awful lot of noise.
Absolutely, yeah.
Unless we retain our focus, it will be forgotten, it will be sidelined. So I really think the work of journalists like myself has never been more important.
Well, Lexi, I think it's time now for our roundtable. So I'm going to leave you the floor. We've got a lot of people from all over the world. Thank you again, all of you guys coming with us, because we have very much a very nice audience coming really from overseas, and so that's great. So thank you again to all of you. And Lexi, the floor is yours.
Thank you. So I would really, I would like to welcome our guests to the floor. We have Sybil Chidiac. Hi, Sybil. We have Sarah Hillware. Hi, Sarah. And I hope we have Gary. Where are you, Gary? Gary Bob. Have we got him? Not yet. Hey, hi, Gary.
Hey.
How are you?
Fine, thanks. Sorry for the delay there. The challenges of technology.
Yes, I know. We may have some challenges, but we're just, we're going to keep on going and we're going to get a good debate out of this, because I am delighted to have you all here. This is a caliber of guests that is rarely seen. So thank you all so much for being here. Just to give a quick introduction to our speakers, Sarah Hillware is the Deputy Director of Women in Global Health. She's an award-winning social entrepreneur, global health strategist, and advocate for girls and women. She's a deputy director, and just to tell you a little bit about Women in Global Health, it was founded in 2015. It has more than 20,000 supporters in 90 countries, and it's growing all the time. So thank you so much, Sarah, for being here. Gary Barker is the CEO of Promundo. He's a leading researcher. I mean, you will have heard of him. He's a leading researcher on men's use of violence and ways of, moving towards non-violence. He's a huge voice in engaging men in gender equality, which is a subject close to my heart, because I really believe that we get nowhere unless we're all together in this. He's done a lot of work in post-conflict Africa, Latin America, and the Middle East, and is leading the fight to engage men as fathers in this debate. And, just because he's hasn't got enough on his plate, he's also a successful author. Sybil Chidiac, the Senior Program Officer at the Gates Foundation, and she's a global advocate for women's savings groups. So she has this really incredibly deep understanding of how solidarity and organization can transform women's lives, amplify their voices, and give them a platform. So she's a leader in developing these groups across Africa, and I've spoken with all of our participants before now, and their passion for what they do is fantastic, and I'm just so delighted to have you here today. Chaps, what I'd like to start off with is just from your own work and from how you've seen, what are some of the main impacts that we've seen emerge during COVID-19 in terms of gender equality? I wonder if, Sybil, you could just tell us a little bit about how women who you work with have been impacted.
Yes, thank you so much, Lexi, and greetings to everybody. As Lexi mentioned, I work with women's empowerment collectives, which are essentially groups of women who voluntarily come together within their communities and create very much a safe space for themselves to discuss topics that concern their social, financial, their health, their well-being, and other matters that can't be discussed openly. They discuss barriers, social, political, cultural norms, and really things that have been dictated to them due to tradition, due to society, how they act, what they should do, where they should go, how they should act in their house, they should act in their villages and their communities. And essentially these women come together, they meet under a tree, on regular instances. It could be weekly, bi-weekly, and they figure out how they can combine their resources. Their resources are knowledge, their resources are financial. A lot of these groups are savings groups at the base, and they save and they lend together, and they support one another. So collectively, they look at how they can make changes little by little. And today, these group-based approaches are being recognized by government. And we're seeing that they are showing us, these women's empowerment collectives are showing us that they can withstand shocks and lead community resilience and recovery efforts. They're really looking at protecting the health and well-being of their communities. And groups have been role modeling hygiene and safe practices. In Benin, we're seeing groups coming together and practicing social distancing, erecting hand washing stations in the communities, and also placing them at key strategic points where the groups meet to really foster and ensure that women, as they come to the meetings, they're washing their hands, and as they exit the meeting after touching money, they also wash their hands. They're promoting smaller group sizes, and they're limiting cash handling as well. They're sharing health messages in Burundi on how to prevent the spread of COVID and how to respond. Looking at digital technology, we're seeing many women have access and use mobile phones. And so they're using digital technology to text these messages, create phone trees, use WhatsApp to really spread messages and amplify the WHO health guidance. There's also many other examples in Uganda. We're looking at groups that have been refocusing their finances, looking at how they can push some of their funds towards the most vulnerable members of the group. They're repurposing their emergency funds. They have these social funds that they can tap into that they themselves have been putting aside little by little. And they're using those emergency funds to support group members, but also members in the community who are more vulnerable, such as the elderly, widows. They're looking at how they can accelerate cash outs for their members. And really, some of them are even creating COVID-19 funds. Yeah, so they're doing a lot in terms of what they can with the resources that they have.
So these are people who are already, you know, taking a difficult situation and immediately trying to find solutions. That's incredibly inspiring. And I wonder, Gary, if I could bring you into the conversation here. And we were talking, you said you've done research into the impact of, you know, I mentioned before that women had been doing more childcare, but men had also been doing more childcare. Can you tell us a little bit about that?
Yeah, you know, we before COVID, there was already a huge inequality. If we look average around the world, women are doing 3.3 times the amount of the hands-on care every day in our homes. COVID, of course, has increased, and we've seen different studies increasing from 2 to 4 hours more per day that women are doing. Men are doing more as well, but we have to remember we started unequal. Everybody's shifting up, but that inequality is still there. You know, and the stress on women, we've also seen in surveys that we've done together with Oxfam, men have been more likely to keep their paid work and more likely in some settings to be able to take that work home. So women are both facing increased economic challenges and doing more at home. The good news is that in some parts of the world, we're seeing men do kinds of hands-on care work they didn't do before. In some parts of the world, men have already been doing it, just not a fair share on average anyway. But in a few countries, we're finding men are actually doing some more of it and doing kinds that they thought before somehow they lost status or lost face, or they'd be made fun of by men in their community if they did this work. So finding that to be encouraging. Another piece that's encouraging is that we also asked in a couple of countries, would you support parental leave policies, more access to childcare as a policy? Men are tending toward women and what they think about those. And in most of the world, it would be good news if men voted more like women, in the sense of voting for social policy, voting for approaches that support women's needs for health and access to income and all the rest. So, you know, the glass is definitely half empty, but there's some reasons to think it's also half full. We've also been looking at how we engage men around health. In many parts of the world, men have been less likely to follow the precautions of hand washing and mask wearing and social distancing. So we've also got to look at that and calling attention to men that of the nearly 1 million deaths from COVID so far, about 60% of those are men.
Yeah.
We've got a slightly higher biological risk, but we also as men don't seem to be as good at following the basic precautions. And, you know, not to start any gender wars about men dying more. When men die, it's women who pick up the pieces at the household level and have to carry on. We've been doing the care for men if they've been chronically ill or ill at the end of life. So we do work with men in a number of settings around the world, parent training work with young men around promoting violence prevention. We're also advising a couple of countries. The city of Bogota, for example, is setting up a new hotline for men around mental health issues, but also around the potential that they have a place to seek someone to talk to before they might use violence against a partner. So also trying to look at ways that we get bystander approaches so that men speak up when they see other men around them, neighbors in the workplace, elsewhere in your family setting, when you see other men using violence, because we know what COVID has meant in terms of seeing a spike in violence and the difficulty of women seeking help if they've been victims. So Again, a mixture of challenges, but also a couple of, silver linings that maybe we need to make some noise about.
Can I bring Sarah in here to get the women's global health perspective? From my own work, I've seen that whilst, like Gary said, there's been, we do seem for now that men have a higher morbidity rate here, but we've also seen massive impact in women's health, haven't we? Could you tell us a little bit about that?
Absolutely, and thanks so much, C. For women, this is really a story of existing inequality exacerbated, right? So the lack of access to to contraception and the lack of access to SRHR, and what we're hearing is that there's a global pandemic, and so we don't have time for gender equality. We only have time to tackle the global pandemic, and what we're saying is actually no. The overall response won't be effective unless we put gender equality at the center. And what we mean by that is not only what you traditionally hear, which is SRHR and contraception, but the women actually at the front lines, and the women who are actually at the table, and then those who aren't at the table. So right now, a lot of people don't know this, but 70% of the health workforce is actually female. And so that means that, majority of the nurses, midwives, and community health workers are women. And those are the ones who are at the front lines of this pandemic. And oftentimes their working conditions are poor. Oftentimes they're unpaid or underpaid, or, paid months, delayed. And so this is actually not only exacerbating the public health issue that we have, but also the broader economic issues, that are accompanying this pandemic. And actually, one story I'd like to tell is one from Ethiopia, and that is that about 40,000 of their health workers are health extension workers, which means that they have 40,000 health workers who are outside of what you would normally consider, the health system. Yet Ethiopia has actually brought them into the formal labor market, and they're now paid. And these 40,000 extension health workers have screened over 40 million people across 11 million households, right? And so, these are majority women.
It's quite something. I mean, just slightly going backwards, one of the most shocking stories I think I wrote during the pandemic was we obviously, there was a crisis in PPE in the UK, as there was in very many countries, and access to PPE. But what we weren't talking about regularly, that despite the fact that 70% of health workers are female, getting PPE to fit them was almost impossible.
Absolutely.
PPE had been designed for a white, a Caucasian male, not for women. And I had spoken to countless doctors who were coming home with lacerations on their face from trying to pull a mask so tight to keep them safe.
Yeah.
And this is what we're talking about, isn't it? If women are not involved in those leadership decisions, then things just fall by the wayside. And that brings me, I'd like to speak a little bit about leadership. And I think it's really interesting. The recent study showed that the countries led by female leaders suffered half as many deaths as those who were led by male leaders. And again, like you said, Gary, we're not here to start a gender war or culture war. We are here to try and find solutions. So what is it about, I don't assume, that those women are better because they're women. We don't think that. But what is it about, bringing in, making sure female voices are around the table? How does that improve reaction to these kind of crises? I'll just leave it open, whoever goes first.
Yeah, I can take that. And I think that speaks a lot to our mission. So even though 70% of the health workforce is female, only 25% of women actually are represented in global health leadership. And so that means that you essentially have decision making that's made by those who don't represent those that they're making the decisions for. And so, you know, when you say, Lexi, you know, when you cite your work that essentially, you know, countries led by women are doing much better, you know, in the COVID-19 response, that's not because they're women, you know, but so we actually had, I'll give one quick example. We actually had a recent civil society event with Dr. Tedros, Director General of WHO. And one of the critical, you know, things about the civil society meeting was that we actually brought women from the front lines to talk about their experience. And you know, one of the really I think key characteristics of Dr. Tedros's leadership is that he has an inclusive leadership style, meaning that, you know, all voices are able to be heard at the table. And so, you know, actually, the Prime Minister of New Zealand actually said that she has a team of millions, right? So, you know, it's not because she's a woman that, you know, the COVID-19 response has been better, but because of her inclusive leadership style. And we call this gender transformative leadership. When you actually have women in leadership positions, they actually ensure that those who are from marginalized populations that their voices and that their needs are included. And so, you know, when you start from that common denominator, then things are better for everyone. And the same with gender equality. When you start with gender equality, then that makes things better, not only for women, but for men as well. And so we see women adopting this inclusive leadership style that's not exclusive to women, but that men can adopt as well, but they don't, right? And so I think everyone has a choice to be an inclusive leader, and you know, to ensure that inclusivity is reflected in the way that we carry out policies and programs.
Sure. And I'd just like to bring Gary in here, because one of the ways in which leadership was found to be incredibly important was having sight of problems that might be coming down the line, particularly in terms of gender equality. So in places like New Zealand, where women were around the decision-making table, there were plans put in place to deal with an increase in domestic violence. So we know from UN figures that there's likely to be a 20% increase in domestic violence globally as a result of the pandemic, which, you know, absolutely horrifying statistics. Gary, what can we do to, you know, to tackle that pandemic, that separate pandemic, and, you know, how do we make sure that voice is heard in amongst all the noise?
Yeah, and partly, and I'll touch on something that Sarah said as well, that you know, not only do I believe that men can adopt a more relational, inclusive way of leading when we're leading, but we need to. There's no choice for the world to get better, but that we need that. And I think particularly around, I don't want to let any male leader off the hook of saying, well, you know, I've hired a woman who's going to look at the caregiving issues or at gender-based violence. We need men like Dr. Tedros and many others, and men as heads of state or members of parliament or houses of Congress, et cetera, to say this is an issue that affects us as well, that we need to be part of. The violence we're talking about, and even how we call it in the world, we often say violence against women as if it falls out of the air someplace. This is men's violence against women in 99% of the time. We've got to call it that and acknowledge it. And I think what we know that COVID has done is some countries have had good laws and protection systems in place. No country has as good as we think they should be, but we've done some work over the years to build those systems. We know those are stretched. Resources available for them are not there. We know that staff can't get to them. So there's a lot of things we know that we need to do. One, we need to make those essential services that remain open in terms of psychosocial, medical, legal protection for women survivors, shelters, and the rest. We need to come up with creative ways that women are allowed and can, not allowed to, that can call for help. And many countries are trying a number of online approaches to that. We need to make sure that when social protection policies are in place, cash transfers, cash support available, that women survivors of violence are at the top of that list and are able to access those easily and quickly. And then we also need to do the prevention work to make sure that we're reaching out to men and boys and young men during this moment to put in place the few things that we know that can work in terms of engaging men as allies.
Mm.
And we need heads of state making it a priority. And again, I go back to that point of, I want, the countries that have male leaders, for men to feel that we are holding them accountable to do this as well, and being part of that issue. And I think we also need better data on it. That's the other thing that we're thinking about, is really to understand, because this is an extremely hard moment to get data about, in terms of how frequent it is, how much it's happening. So that is no minor thing as well, to know how much the epidemic of violence against women is being exacerbated and going hand in hand with the COVID pandemic.
I'd like to just bring us on to the workplace a little bit before moving on to some hope positives and solutions. I'm kind of conscious of the time, but we know that the UN have told us that women are losing their jobs at a faster rate across Asia and the Pacific region. In the UK, 47%. Women are 47% more likely to have lost their jobs than men are. And we've seen in the US, there's a larger spike in women's unemployment than there is men's unemployment. So what are the tools that we need to make sure that the inevitable financial consequences of this pandemic don't fall more heavily on women? Sybil, would you like to talk to us about that?
Yeah, and if I can also loop back on the women in leadership question. Just wanted to say a few things about that, which look beyond looking at highest level of government and looking really to the rural communities and the millions of women that exist in African countries across the continent. When looking at how they start to engage in political processes, they start not at the highest level. They don't necessarily start in parliament. They start with their local leaders. They start with their chief. And what we found is that through these women's collectives, women start to gain that voice, gain that confidence, and gain the numbers that they need to approach their leaders and start advocating and asking for the changes that they need. So this is truly a fundamental building block of sorts to really get women in leadership and women politically participating. In Niger, in Mali, in Cote d'Ivoire, we've seen women that have started in these collectives go on to become members of parliament. They started by learning how to use their voice at the community level and advocating for change at those levels where it mattered for a majority of women in the country. And on to your question, I do think that when we're looking at economic recovery, when we're looking at stimulus packages, we have to include women businesses and women enterprises. We have to consciously think about and do analyses to understand what types of businesses are women running. What is the size of their businesses? What sectors are these women running enterprises in? And what are the barriers that they're currently facing in accessing capital? There's always an issue of collateral that women cannot demonstrate because they don't have access to titles and land. There's issue of identity sometimes. And there's issues of mobility, and this is where that digital technology plays a strong role. But we do know that there's a lot of things that need to be considered in order to really ensure that women have access to capital in order to recover their businesses, expand their businesses, maintain their businesses. As Gary mentioned, when you see a male spouse coming home from an urban setting because he has lost his job or daily wage, he goes back to the village, he sits at home, and he is now dependent on the woman. Whether he is affected by COVID or not, economically, the household is now affected, no longer having the income from that male.
Yeah.
So the burden is on the woman. So I would definitely advocate for looking at how do you capitalize women enterprises, and how do you do so in a manner that is going to have returns and it is going to have long-term sustainability. We're seeing efforts like this through cash transfer programs in Uganda, where the government has set up a number of women's enterprise groups, and they're using those groups that they have formed and created in order to channel some of these funds in order to really ensure that these enterprises can maintain during this pandemic.
I'm conscious that we're going to go on to the Q&A very shortly. What I'd like to do is put you all on the spot and insist on a very short sentence of something positive that you think that has come out of the pandemic. So we're not entirely focused on negativity. And one ask what you would like to see, but very short, please. Gary, why don't you kick us off?
One I've seen is men finding their stake and the personal connection in being involved caregivers. And the ask would be that care work be the center of all social, well, be at the top of social policy asks, both in COVID and beyond.
Wonderful. How about you?
One positive that has come out of the COVID-19 pandemic is that we are now, I think, valuing unpaid care work. So the care work that, you know, women do, especially, is now under a microscope.
Mm. And Sybil.
Yeah, I think, you know, coming from the women's empowerment collectives angle, I think I would have to say that these collectives are showing us that they can withstand shocks. This is not the first pandemic that or shock that these women have faced through collectives. And this is why the Bill and Melinda Gates Foundation believes these collectives are high impact, efficient investments that governments can make in its citizens, especially women. And I would ask that governments think about their economic recovery and stimulus packages to be gender intentional. And it goes back to that point I made about women enterprises, capitalizing those enterprises and removing the barriers. This is an opportune time during the pandemic to make changes that can really last the long term and make systemic changes for women.
Fantastic. I'm glad that we could end that on a somewhat positive note. I think we're now going to open the floor to questions. If someone is going to come in.
Can you hear me well?
Hi.
Hi, hello. So we do have a few questions. One from Marc, so I'm going to say it loudly. I think Gary already mentioned some of elements of the response, but I'm sure you can add some elements. So the question is, changing men's attitudes towards flexible working is vitally important in achieving gender equality between working parents. How does the panel think organizations can encourage and normalize caregiving masculinity for working fathers?
That's a fantastic question. Who wants to take it up? I will just say, for just to cut in, that I have already been lobbying my company hard to maintain flexible working, because it is such a game changer, not for women, but for everyone, for working parents. And, you know, this is a moment where we finally don't have to pretend that we don't have children. We finally don't have to pretend we don't have other caring responsibilities. You know, we are fully rounded human beings, and this is an opportunity to embrace that and make sure that work, you know, the way that we work does not fit a routine that we last saw in 1950. So we need to rethink work, don't we? Anybody else?
Sure, I'll jump in on that question. I mean, one is better leave policies that don't treat men as the secondary caregiver. We have been the secondary caregiver because we haven't done our share. But I think we need strong nudge policies that say equitable, paid, supported in the workplace in the sense of transition to and from. Men need to see other men doing it. So that's men from the top, but men at all levels, so that this becomes normal, that you see it at work and afterwards. We need countries having national goals. We do every 2 years a State of the World's Fathers report, reviewing policies on leave and other. We have found no country that has put a goal that men and boys would do 50% of the unpaid care work. And we know that with global goals, and Gates has been fantastic on this and reviewing where we are in the SDGs, if we don't have a goal and measure it, we're not very likely to achieve it. So one is, I'd love to see countries brave enough to say men can do half this work, and the world needs men to do our part from a justice and gender equality point of view. Social protection policies also need to. There's lots of good reasons that cash transfer programs and stimulus packages focus on mothers. We don't want to change that, but we need to find ways that within those we can nudge, a tremendous way to nudge men to do our share. And we need to see corporates and workplaces being part of this. Often, and we've seen that in some corporations, they'll offer a great policy, but they don't really expect any men to use it. They never really expected women to use it very long either. We need corporations to really make sure it's not just a policy change, it's also a norm change, and to make that happen. And lastly, we need boys to see adult men doing this.
Absolutely.
And nudge toward it, because we know it often starts very early, that girls are doing a lot more in the home, starting early on. We need sons and boys to see this really early on, that there's no choice. You're expected to do it, get on with it. You know, life will be better for you too.
Yeah.
All the above.
Great.
Wonderful. Should I ask the second question?
Is it, Sybil, Sarah, are you okay for us to go on to the next one? I'm slightly conscious that it would be good to get through some of them. So we'll to Sybil or Sarah next question.
That's right. So the question is, what do you think about recovery funds like EU1? It's difficult to see the precise amounts that will be especially and concretely used to reduce inequalities between women and men that increase because of COVID. Do you think it will be better to have specific recovery fund for women?
That's a fascinating one. Who wants to take that up? So you've worked in this area somewhat, and you know you have a very good idea of how finance can be targeted to work. How would you answer that question?
I think it goes back to the point that I was making about having a voice and focusing on gender intentional plans, economic recovery and stimulus plans, and really ensuring that there is actually women at the table who are contributing analyses, gender analyses that they've done through their work into the formulation of these plans. For instance, you know, I'm not going to name the country, but there's a country that I'm working with that the president has set up an economic task force on COVID response and recovery. And this task force, their goal is to develop an economic recovery plan. Around the table, you will find every single ministry of Trade, Ministry of Finance, Central Bank, Ministry of Health, Ministry of all the different ministries, except the Ministry of Gender or Ministry of Women's Affairs. So why isn't this ministry at the table for such an important plan that's being put together to really develop, you know, the recovery, the path to recovery for the nation? And you know, you often see that the plans are sometimes formulated and then afterwards, well, okay, let's get the Ministry of Gender to weigh in and kind of do a kind of review and how we could genderize or make this more gender intentional. It's after the fact. And I think we need to see more governments taking leadership in actually reserving a seat at every single table around strategies, plans for the Ministry of Gender, Ministry of Women's Affairs. There are a number of assessments that exist out in any country, done by the United Nations, done by NGOs that have evidence that we've brought forward, you know, during this short time around the impact of the pandemic on women. So it exists, it's just not being utilized. So I do think it's about having a seat at the table and making sure those analyses are being used.
And Sarah, do you think that we need targeted funding to actually make a difference?
So I actually want to respond to Sybil's point, and actually did an analysis, and 8 out of 10 national COVID-19 task forces have a majority, right? So we can't have gender at the center unless we ensure that women are actually at the table regarding decisions being made about them and their families and society, right? We can't make decisions about 50% of society without 50% represented. And that's one part. But the other part is that, you know, we need to have gender responsive systems. We need to have gender responsive approaches to programs and policies. And unless we actually ensure, you know, I think Sybil really hit the nail on the head, but unless we actually ensure, you know, that we are disaggregating data by gender, you know, that we are, you know, actually taking a look at the impacts on women, we can't design policies and programs that address that. So, you know, I think our ask number 4 and our 5 asks gender disaggregated data plays a huge role in ensuring that any system can be gender responsive, because we can't address what we can't measure.
Yeah. I think one kind of slightly more journalistic example that really struck me during the pandemic was as the UK reopened, different industries were reopening. There were, you know, policies put in place to make sure that different industries could reopen. There was a plan that the government had. And every time there was an announcement about an industry, it never included the beauty industry. And in our parliament, a female MP brought up the beauty industry, and a male MP started laughing. You know, and that industry is worth £30 billion in the UK. It's, you know, it's worth more than the automotive industry. It's huge. So, but the positive point of that was, you know, there is an MP, a member of Parliament, who is the chair of the Women's Equality Committee. So she's not a minister, she's not around that table for sure, but she is very noisy. And she had very good links with the media, including me. And it turns out that there is more than one way to skin a cat. So if you continue to make that noise and, you know, plow that intention and make good contacts with journalists, and journalists are, you know, open to good stories like this, because you can get some great voices from the beauty industry, let me tell you, then you can still make it. You can still make a difference. So there are more than one way, I think, to make those voices heard.
We have one last question. So the question is, how can organizations introduce the discussion on addressing unpaid care work in Africa?
Good question.
That's a great one. Yeah, that's so, you know, one thing I want to point out is that, you know, with the health sector especially, it's an extremely large employer, and so I'll just sort of use an example from the health sector, and that is that, you know, essentially, you know, we are relying, you know, the health sector is built on a house of cards that relies on, you know, this huge section of unpaid work. But when we don't pay those who are actually delivering services, and when we are, you know, essentially relying on people to do work unpaid, then that actually impacts those who are receiving those services as well. So it has an economic impact, not only for the individuals delivering, but also for those that are on the receiving end, you know, meaning that, you know, the quality of care suffers, you know, also meaning that, you know, those might not be able to access care. And so, you know, when you rely on unpaid work, you not only have a system that is sort of resting on a house of cards that, you know, will come tumbling down at any moment, but you also have, you know, just this sort of you know, tornado of, you know, issues that can happen in the supply chain. You know, and I think one example of that is actually in India, where the state community health workers, the ASHAs, are actually now facing quite a lot of violence. You know, a lot of them haven't received pay in months, and you know, because they also don't have decent work conditions. So not only, you know, is a lot of their care unpaid or severely underpaid, but because they don't have decent working conditions like PPE. There's actually, you know, a stigma that's developed that they're spreading the virus when they go door to door to do contact tracing. And so they can't actually do their jobs, and therefore the contact tracing efforts are undermined, you know, because of the, you know, lack of pay, the lack of decent working conditions, and the undervaluing of the work that they're actually doing on the front lines. So, you know, it's not just about the individual, her, you know, him or herself. It's also about the impact overall of, you know, the system and of the COVID-19 response, right? So we must pay workers, not only in the health sector, but in all sectors, and recognize the value in the service of what they're providing, to the system overall and to the economy.
Sybil,
Maybe, yeah, definitely want to jump in on this one. So as as we've discussed, we're seeing that disproportionate burden of care falling on the woman, care of elderly, children, spouses. But I also think that as things are starting to equalize, as things are starting to be discussed, norms are shifting, and that burden of care may shift to men. There's also an opportunity to look at enterprise, and whether you're in an urban setting, whether you're in a rural setting, a creche, a daycare, a nursery is a wonderful enterprise that could be pursued. And women's, can band together in collectives in order to form those enterprises, or women, individually can create those enterprises. This is something that we see in North America. We see it across Europe. It allows men and women to work, whether they're, independent business owners, or they work for an employer and, they go to a job 9 to 5. They have the ability to seek care and put their children in care, and even elderly in care for some time during the day. So this is definitely an opportunity that we can see as funds can be distributed to really, propagate and really grow these types of enterprises that women, can start and grow, but others can also start and grow. And this can stimulate the economy. People can go back to work. Things can open up, be it in a rural community setting or an urban setting.
Thank you.
I'll just jump in there as well. We're doing parent training with fathers in several countries, with partner organizations in parts of sub-Saharan Africa, trying to break the notion that men won't do this. Using prenatal visits is one of the points of entry when the female partner wants him involved. Finding ways to get men to come to group sessions, sometimes with their partner, sometimes without. Trying to reinforce those norms at the community level, and then engaging the health sector to begin to talk to men more about being part of the process of follow-up with vaccinations, follow-up with healthcare. We're doing some work in West Africa together with the UN Population Fund on what are called École de Mari, or husband schools, using ways to engage men and sensitize as well, making it a group thing to break the stigma that men can't do this. And then, of course, the big challenge is taking that into policy. So it's not just a handful of programs, but this becomes something that the community is saying, we expect men and boys to do this. And I love Sybil's approach as well. I think we also need to break some of the barriers around paid care. Why aren't more of our sons aspiring to be nurses or to be childcare workers? These are dignified, should be well-paid professions. While we nudge and support women to be in the STEM professions, we need more boys and young men aspiring to be in the heal professions. So I think that's the other piece that we see the need to do.
I absolutely agree with that. I'm just going to say something slightly controversial, which is
yes, and then we'll, sorry Alexandra to cut you off, but we're slightly running late, so I'm let you doing the closer notes, and then I'm taking the mic afterwards.
Sure,
go ahead.
So just on that point, I also think women need to make the space in the domestic sphere, because I think there is occasionally a tendency to put all of the all of the power in the domestic sphere into the women's hands. So all of the questions about baby raising are always, what does the mother think? What does the mother think? And I think also there has to be, well, yes, but also what does the father think? This baby, for example, was a joint endeavor. So how can I make sure that I'm also making space to make the men in my life feel that they are welcome in that sphere? Because it's my husband's been to baby group, it's not always a welcoming sphere. And to sum up a little bit of what we've been talking about, I think some of the key points was that we have to value care work, and care work has to be valued in an equal sphere as any other industry. We have seen during this pandemic just how vital carers are. Countries would have collapsed without people, mainly women, on the minimum wage. Some care workers staying for weeks at a time in their care home to look after their elderly clientele. So let's all be pushing for a change in the value of care work. We need more women around the decision-making table. We need more women leaders, but we need people who are there on a daily basis, getting involved in that debate. Part of that is making sure those voices are heard and amplified in the media. So the media really has a role to play here. Speak about those voices, make sure that you are making sure that they are heard, because that is also our responsibility.
Thank you so much, Alexandra. Okay, thank you so much to all our speakers. I'm sorry we're a bit running late, but yeah, thank you, Alexandra. Thank you, Sybil. Thank you, Sarah, and thank you, Gary. Alexandra, we will see you back at the end of the webinar for the closure note, so you're just coming back later on. So thank you so much to all the speakers, to this very engaging discussion about the impact of COVID-19 on women, and we talk about lots of topics during this this webinar. So we talked, yeah, thank you all. And we talked a lot about, you know, the power of communities and also gender transformative leadership. And we at Sparknews, we truly believe that it's very important to shed light on social entrepreneurs that bring solutions, concrete solutions to the most pressing issues. And that's why we really wanted in this webinar to invite you know, inspiring entrepreneurs who can bring solutions to the gender equality issues on the ground. So thank you, everyone. I think you'll get back later on. And now I'm going to invite on stage the first Sorry. So yeah, I was about to introduce the first entrepreneur on stage, but just a quick reminder about the questions. So here again, you can ask your questions in the chat or in the dedicated section. Do not hesitate to upvote the questions you think are the most relevant. And after each speech, we'll take a little time to answer the questions directly after the entrepreneur speech. So we won't wait until the end. All right, so the first entrepreneur to come on stage is Julie Heinz. She's Director Global Communications at Barefoot College, a social enterprise based in 1972 with the aim of empowering rural women, often illiterate, and to encourage adaptable communities. So Julie, I believe you're calling from Zanzibar, Tanzania.
I am, thanks.
Yes, so the floor is yours. You have 4 minutes to pitch, and then we'll take a few questions.
All right, great. I'm going to start my own timer. Oh, you've got the timer up.
We've got the timer. Yes.
Okay, fantastic. So thank you so much. And thanks for inviting us to be a part of this. So I do, as mentioned, I work for Barefoot College, which is a nonprofit global social enterprise founded in Talonia, India, in the state of Rajasthan, almost 50 years ago. And it offers a myriad of experiential learning opportunities designed alongside the local people from the most remote areas of the world for women and children who have never had access to or have been denied access to any type of formal education. So Barefoot knows when you educate a woman, you educate her family and her community, which is why we primarily put women and education at the center of our work. So these programs that we offer to women through our vocational training centers are designed to help participants realize and reach their full potential while inspiring them to grow into agents of change. You may have heard of Barefoot College's solar electrification program, which trains women between the ages of 35 and 65 from the most rural villages around the world on how to become a solar engineer. We call these women our solar mamas. And when they are finished with their 5-month training, these solar mamas return home with the skills they need to electrify their home, their village, which means more light for students to study with, more light for shop owners to keep businesses open, and of course, safer, more affordable, and healthier options for light over kerosene. So while climbing up on the roofs and installing solar panels, these women are at the center of providing solutions to many challenges their communities face, and at the same time are breaking stereotypes. So we knew this when COVID hit, that our solar mamas located in some of the most rural communities around the world who many times have access to misinformation or no information at all, could be pivotal to ensuring the proper dissemination of life-saving information. It's the same sentiment that Sybil was speaking about around women's collectives and enterprises and giving women a seat at the table. So this in mind, today I will share 2 priorities that Barefoot College identified in providing immediate support to the women and the communities that we serve. So we immediately adapted our enriched training, which I'll speak of, to better support women. And second, we capitalized on the digital technology to ensure our solar mamas, their families, and their communities could immediately receive the information that they need to protect themselves and their communities from the impact of COVID. So the Enrich module is included in all of our training sessions and teaches women about their health, their bodies, helps them understand their own rights as a woman and a human. It also teaches them skills in financial literacy, like how to open a bank account, create a budget, and save. And then also about micro enterprise to help them as they become engineers. And these are all, and they're also taught how to use and given a cell phone. And all of these skills have been helpful to them during COVID. So the first thing that we did for the women on campus was incorporate the COVID prevention and symptoms in line with the recommendations from WHO into our training. And we also collaborated with our partners to introduce new modules around domestic violence, which was discussed, mental health, to complement our already existing social justice and health modules. As for the Solar Mama graduates back in the 93 countries around the world living in their home communities, those cell phones I mentioned became a lifeline and are our primary method for disseminating the same new life-saving information. Sybil mentioned earlier the cell phone. So, oh my gosh, wow. How did that happen? I've been so good.
Please do finish your sentence. Yeah.
Oh my gosh. I look over and it was at 0. I couldn't believe it.
Please finish your sentence.
Well, so to their phones, we've been sending films on myths and stigmas, as well as how to mitigate the effects of COVID. They're being translated in 21 languages with 6 already translated, and they're all accessible on YouTube. We've sent surveys to collect information to better access the situation in their areas so we can collaborate with our partners to do more to provide relief and support. And so this is a big priority for us, using digital technology. So, and we're going to continue to collaborate with governments and heads of state, as Gary mentioned, corporations, civic societies, to make sure that the women and the communities they are part of have access to what they need to stay smart, financially stable, safe, and healthy during these challenging and unpredictable times.
Thank you so much, Julie. That was perfect.
Yeah, sure. Okay, great.
Sorry, it's a bit stressing this timing. All right, so
okay.
I'm looking in the chat to see if we have questions. I don't think so.
Sure.
That means that the pitch was crystal clear. I do have a question. I mean, you mentioned in your pitch the fact that you were giving phones to the women you were working with, and that was a tool to actually give information about the COVID. But did you somehow involve the women as reliable sources of information to actually spread the word in their communities about, what's true, what's not true in the COVID-19 crisis?
Yes, so I think this is the crux of why we felt our solar mamas were so valuable in this situation. Our solar mamas, we select solar mamas from these rural communities because they are leaders in their home community. So we know that when we give them this information, that they're going to take it and they're going to run with it, and they're going to share it with the people and the families in their home community. So that was some of the excitement around we'd already taught them and given them the skills around how to use the cell phone and these digital, technology skills to help them collect the information and share it with others. So, yeah, definitely.
Wow. Wonderful.
Yes.
So do we have questions in the chat? Not sure. Let me check. Sybil has just said, many of these solar sisters get the startup funds from the savings or a loan from the Women's Empowerment Collective's saving groups.
I'm sorry, could you repeat that?
Sorry, so Sybil was saying many of these solar sisters get the startup funds from the saving or from a loan from the Women's Empowerment Collective savings group.
So we actually get the majority of our funding from the government. We have a partnership with the government. So they fund our programs, and we also, I mean, it depends on which programs you're speaking of. So for Enrich, we do have private funders. For our solar programs, we work side by side with the government. They provide a lot of the funding. So it varies.
All right. Well, thank you so much, Chidiac. That was very interesting. Now I'm going to welcome the second guest on stage, who is Hauwa Ojeifo. She's a One Young World ambassador and founder of She Rights Women, a movement that gives mental health a voice in Nigeria. So, Julie, I imagine you will leave the floor. I think the technical team is going to remove you from the stage, and we can have Hauwa Ojeifo with us. We're very honored to have you. So, Hauwa, you have 4 minutes. The floor is yours.
Thank you. Thank you so much for having me. Yes, so my name is Hauwa Ojeifo, and I publicly identify as a person who lives with a mental health condition and a psychosocial disability. I am the founder and executive director at She Rights Women, which is a women-led movement that gives mental health a voice in Nigeria by empowering people who actually live with mental health conditions to co-create their own solutions, advocate for their own rights, and tell their own stories. And we're generally doing this by creating safe spaces, telling our own stories, and normalizing these conversations in the face of overwhelming stigma and misinformation of mental health and related issues in Nigeria. Now, over the last 4 years of doing the work that we do in raising awareness, advocating for inclusive and human rights respecting mental health legislation, creating intersectional solutions, we have reached over 2 million people and directly supported over 3,000 people with our monthly support groups, helpline, and community center. And of course, COVID-19 has really changed the dynamics for us, but I think it's important, as we have already heard, that COVID-19 affected us all, but it hasn't affected women equally, and more so, and I think that's a part of the conversation that, we tend to feel a bit left behind, is that it hasn't affected women with mental health conditions and psychosocial disabilities the same way as well. So at She Rights Women, we saw during the lockdown period, the early parts of the pandemic, where we saw 80% of the calls that were received from our helpline from women experiencing relationship-based distress, intimate partner violence, and gender-based violence. And women who already, according to the World Health Organization, carry the burden of mental health issues globally, saw their conditions being exacerbated during the lockdown due to interruptions in coping mechanisms, disruptions in patterns, and insecurity from being locked up in places with your abusers, with limited access to systemic support like shelters, medications, social support therapy, and things like that. And so we responded, first by assuring our community, as a very close-knit and often marginalized and vulnerable community, that indeed nothing about us without us can be a pathway to leaving no one behind and reaching the farthest behind first. And thanks to development partners during this period, AstraZeneca and One Young World, we were not just able to, provide first response through helplines, virtual support groups, and teletherapy, telecounseling, but we also ensured that we're empowering this vulnerable population and this marginalized population with call airtimes, internet, to ensure that our response is accessible and it is truly reaching the people who need it the most. Beyond that, we started lots of conversations online with targeted campaigns on gender-based violence and mental health, which we saw within 1 week. We got over 1 million Twitter impressions following multiple cases of women who were raped and killed during the lockdown in Nigeria. We created multiple kinds of multimedia content across social media, thanks to MTV UK and Human Rights Watch and other media organizations. I think one aspect that also stands out in how we do the work that we do is that we ensure that we included the issues of legislation in how Nigeria is responding to mental health. And we saw COVID-19, and COVID-19 has generally affected the work that we do. And mainly it has reinforced the fact that mental health issues cannot be resolved independent of poverty And what I mean is that poverty is a huge indicator and determinant of the mental health outcomes of a people. And we saw that firsthand during the lockdown. We're realizing more and more the importance of proactive legislation in strengthening the country's health and response to systemic threats like COVID-19. Nigeria doesn't have a mental health law. We haven't had one since 1957. And lastly, we're getting more innovative in ensuring that not only are we leveraging internet and creating virtual communities and psychosocial support, but also ensuring that we're thinking of innovative solutions to reaching the majority of Nigerians who do not have 24/7 internet access through community-based support and toll-free helplines. Thank you very much.
Thank you so much for this time. All right. So let's see if we have a few questions. I don't think so. So I do have one. You mentioned during your pitch the fact that you were also fighting to change the legislation in Nigeria. So how is it to actually, advocate, the voice of mental health rights in Nigeria? Is that something, difficult?
It's definitely complex, I would say. Maybe not difficult, I don't know whether difficult is the word, but it's definitely complex. I mean, it's the reason that we haven't been able to successfully pass a mental health legislation since 1957, which is still called the Lunacy Act in Nigeria, which is quite ridiculous if you think about it. And more over the last 10 years, we see more and more draft bills come before the National Assembly, and then we see that they're not being able to pass through. I believe that one of the things that has caused all of that, failure of some sort, has been the lack of inclusion of the voices of people who actually have mental health conditions. A lot of times what we see is that people are pushing policies and legislation that are not inclusive of the voices and the opinions and the actual realities of people that are targeted by that policy or that legislation. And that's what we're seeing. So this time around, what we're trying to do is to ensure that we're centering our voices and we're trying to fight through to gain inclusion into the National Assembly, the Parliament, to ensure that we're involved in the drafting, in the communication, and in championing the mental health legislation, partly because in the past Nigeria has had legislation and mental health thinking that is not very human rights respecting. We have issues of shackling and detention and forced treatment and irreversible treatment in a lot of even public-owned, government-owned Nigerian mental health institutions and things like that. So I think our work is cut out for us, but it's mostly about ensuring that we're a cohesive and organized movement where our voices are heard and we are appropriately equipped and empowered to gain access to the doors that we need to get into.
Sure, very interesting. And you mentioned as well that during the COVID, you had the possibility to do session online. So is it something that enabled you to reach people outside Nigeria?
Absolutely, absolutely. I mean, over the last 4 years, we have seen people even outside of Nigeria in places that we just felt like were completely, there were better working systems and countries. And then during this period, we saw people even coming on board our virtual support groups. And, I think everybody was really looking for resources that worked for them during this period globally. So that's why we could see, people, coming in from the US or the UK or, other African countries as well. And yeah, I mean, that was good. But I think it's also important that whilst we were reaching all of those people outside of the country, there were also challenges in reaching the people within the country because of obviously what I said with regards to internet and, people not being economically empowered to spend that money at that time, where poverty is like the most immediate, thing on their mind, given the socioeconomic, loss of jobs and, a lot of access during that period.
Thank you. So the time is running, but we have another question. So can you, Hauwa, answer very quickly the questions, which is a question from Quintier. And the question is, how can employers create a workplace that supports mental health? I know that's a hard one, but if you want to share some insights with us.
Okay, fantastic. I mean, first off, when I tend to have this conversation, it's not just about a mental health topic or an issue, because what tends to happen a lot of times is that we then see a lot of employers try to put in certain things, just to show that, okay, yes, we're doing something about mental health. But I think it's about rethinking, work as we have known it, and rethinking workplace culture, in understanding that there is a return on investment on investing in an employer's mental health, and using that and embedding that into the general culture of an organization. So, whilst we encourage employers to, rethink work hours, rethink flexible hours, rethink remote working, rethink, certain kinds of, ensuring workplaces that are inclusive of different ways people work. We also talk about the culture of ensuring that, it seems a bit deeper. It's about vulnerability and shame and bringing our whole selves to work. Because a lot of
definitely a question of culture.
Yes, that's definitely a part of the culture.
Yeah, thank you so much, Hauwa. Thank you so much for this great pitch. So I think you let the stage to the next entrepreneur, who is Marc Hull-Jacquin, who is Executive Director of Shelter Movers, and he's calling from Toronto in Canada, I believe. So Shelter Movers has been identified as an essential service during the COVID-19 crisis, and that's why you maintain your activities during the crisis and with your moving solutions. But I won't tell anything more, and I'll let you the mic. You have 4 minutes, Marc.
Thank you very much, and thank you for everybody for listening into this very important discussion. I started Shelter Movers in 2016 in Toronto, Canada, when I learned about the pervasive problem of gender-based violence in my country. Last year in Canada, a woman or girl was killed every 3 days, often at the hands of someone they know. The most dangerous place in Canada and arguably around the world for women is in their very own home. As I learned about the propensity of this problem in my country, I knew I needed to act, not only as a father and a husband, but as a citizen. Men are hurting women at unacceptable rates in my country and around the world. And as a man, I felt I had a responsibility to be part of the solution. Shelter Movers is a free moving and storage service supporting women and children fleeing abuse. In Canada, like in many countries, you have the police or you have women's shelters, you have support services. But if the woman can't leave her relationship safely, or if she's forced to choose between leaving her abuser and losing everything she owns, to me and to my colleagues, that's an unacceptable choice. Shelter Movers intervenes at a critical moment when the woman is exhibiting the courage that she needs to leave her abuser. We coordinate moving trucks, volunteer movers, security personnel, language interpreters, pet fostering services, and storage. And together, we come together at the critical moment when she's ready to leave to help her gather her belongings, pack them in our trucks, get her and her children to a safe location, and then put her items and her belongings in storage for free until she's ready to move on to her new home. We do one thing and we do it very, very well. We've moved over 1,500 families in 4 years. The pandemic has had an unprecedented effect on our service and on the demand. In March 2020, pre-pandemic, we were moving approximately 50 families per month. And in April, May, June, July, and August were all month-over-month new records. As of August, we're moving 100 families per month in 5 Canadian cities. Our goal by the end of 2022 is to expand and replicate our service to the country's 14 largest cities so that we can serve approximately 90% of survivors fleeing abuse. We can respond within 4 hours of a call for help. Most of the calls we receive are from women's shelters who have been contacted by a survivor and who have confirmed that they have a room for her and her children. And we do coordinate with them by assessing the risk that our clients are facing and customizing the services that we will bring to bear on her situation according to her priorities. Shelter Movers operates in a trauma-informed and survivor-centered manner. Everything we do starts with the courage and priorities set out by the women we're serving. We do serve men, and there are men who do flee abuse at the hands of their partners, whether it's a woman or a same-sex partner. Obviously, that's terrible, and we would support and have supported men and male-identifying people who are seeking our services. But to our previous speakers' comments, this is a problem of men hurting women, and it's important to call that out. Shelter Movers is an opportunity for men to be part of the solution. As the founder, as I mentioned, I may not have known very much about the violence against women's sector or gender-based violence, but I knew that I could offer allyship and I could be a supporter to the women who I serve. Our board of directors is nine people, 8 of whom are women. All of our senior staff, all but one person, are women. I sit as the founder and executive director, but we really rely on survivors and their stories and their experience to drive our process. Shelter Movers works on referral, but we do work closely with survivors, and we hope to expand across Canada very soon. Appreciate your time. Thank you very much.
Thank you so much, Marc. That was just on time. All right, so your pitch was very clear. I had a question. I mean, we talked a lot about gender transformative leadership during the roundtable. So how do you see the role in the role of women in changing the domestic and abuse issue at a political level, and do you know some kind of advocacy?
Yeah, so I think I think the short answer that I would offer to that is that rather than I think everyone has a role to play in ending violence against women. Both men and women have a role to play. I think we have different roles to play. I think transformative leadership from a gender perspective requires male leaders to acknowledge their social location, to acknowledge their privilege, and to acknowledge the challenges that women face when rising through the ranks. And I think the role for women in that is to be supporters of each other as well, and to acknowledge their strength, acknowledge their rightful place in leadership roles, and to continue to push to change the minds of people who look and sound like me, to be honest, and who need to come around to the new reality that whether you're a man or a woman in a leadership position, your organization is not, especially in gender-based violence, the organization is simply not serving the needs of our population if our leaders are not looking to women for a critical perspective and direction. Everything we do starts and ends with our clients, so we spend a lot of our time listening to clients' wants and needs so that we can reprioritize our resources to meet what they want us to do.
Very interesting. We have a question from Alexandra. How is your service funded, and could it be replicated in other countries?
Yeah, great question. So Shelter Movers, in order to ensure our focus is on survivors' needs, we diversify our revenue source. So Shelter Movers will never seek out core operational funding from government or any one single source. We receive foundation support from private foundations, from government on one-time grants. We receive private sector financial and in-kind support, whether it's trucks that are rented to us at a discount, or free storage, or free security personnel, or whatever. And that way, with a diverse revenue stream, we can continue to focus on what survivors want rather than what our donors want. In terms of replicability, the model, I mean, without speaking poorly of our service or simplifying it, it's not rocket science. This is a logistics game, and we've figured out the model that can be highly replicable and operated basically anywhere in the world where there is an opportunity for a security presence, some storage space that is secure, and some trucks. And we need some people to drive those trucks who have been trained to operate in a trauma-informed, survivor-centered manner. Our replication, the evidence of that is the replication of our service between 2016 and 2020 to 5 Canadian cities. Our goal, as I mentioned, is to grow to 14 cities in the next 2 years, and we've been approached by folks in the U.S., Barbados, UK, and France. So I think it's highly replicable.
Wonderful. Thank you so much, Marc, for this wonderful pitch. And now I'm going to invite on stage the last entrepreneur, who is Nozi Samela. She's a senior communication officer at Mothers to Mothers. I believe she's based in Cape Town, South Africa. So Mothers to Mothers is an NGO delivering jobs for women living with HIV and making them, frontline health workers. So please, the mic is yours. You have 4 minutes.
That employs women living with HIV as frontline health workers called Men to Mothers. When we were founded back in 2001 in South Africa, there was a huge problem with mother-to-child transmission of HIV. At the time, mandatory testing had been introduced for pregnant women. However, our founder noticed that many women who were diagnosed with HIV during these prenatal visits simply never returned to care. This was a tragedy because with the right care and treatment, the risk of passing the virus from mother to child is almost completely eliminated. But without this, the World Health Organization says that about 45% of mothers will pass the virus to their children during either pregnancy, birth, or breastfeeding. And to tackle this challenge, we created the Mentor Mother model, employing a woman living with HIV who herself had walked the path of giving birth to an HIV-free child to deliver health services, education, and support to other women. And it worked. From those early days, we've now grown to 10 countries, and we employ 1,700 women living with HIV as frontline health workers. And since the founding of Mothers to Mothers in 2001, we've reached 11 million women and children under the age of 2 and created jobs for over 11,000 women along the way. We have also taken this simple yet very effective model to other health areas like early childhood development and adolescent health, with a mission to create healthy and thriving families and to put an end to pediatric AIDS. Now, a question that has been asked all around is, how has COVID-19 affected our work or the women we work with? So what I want to say is that even before the COVID-19 pandemic, there was already a shortage of 4.2 million health workers across sub-Saharan Africa. And this is something that Mothers to Mothers is working to change. At the start of the pandemic in Africa, when many countries were implementing lockdowns, Mentor Mothers were and still are designated as essential workers by government. And beyond ensuring that women and families get educated about COVID-19 and can be referred for testing and treatment, Mentor Mothers are also ensuring that services in areas such as HIV and maternal health are not forgotten along the way. This is very important because UNAIDS has estimated that an additional 500,000 people could die as a result of HIV service disruptions during COVID-19. And so Mothers to Mothers response has been twofold. We've both adapted and protected. So what we do is we have reduced face-to-face services. We use technology that is readily available to us, such as WhatsApp and phone calls, to engage with clients where possible. And we also, where we have to provide face-to-face services, we have taken steps to protect the Mentor Mothers and their clients by implementing measures to promote social distancing and to equip our frontline staff with PPE. Thank you.
Thank you so much, Nozi. So I have a question. How did you get involved in Mothers to Mothers at a personal level?
Wonderful. So I met Mothers to Mothers when I was just 19 years of age. I was pregnant and had just been diagnosed with HIV. So obviously that was a very difficult time in my life where I was excited that I was carrying a new life inside of me, but I was also frightened that I would die along with my baby due to AIDS-related illnesses. And that's when I was introduced to Mothers to Mothers by a nurse, and I met incredible women who encouraged me and taught me about steps that I could take to ensure that I gave birth to an HIV-free child and that I remained well and alive to take care of my baby.
Thank you so much, Nozi. I don't think we have questions, so I think I'm just going to call back Alexandra and Bruno on stage for the closure note. So thank you so much to all our speakers, and that was very, very fascinating to have you with all your very concrete and on-the-ground solutions. So thank you all.
Thank you, Camille. Thank you all. That was amazing. That was really great. I can see a lot of passion there. which is great, even with the speakers and of course with our entrepreneurs. Don't forget, we're gonna send you very soon a newsletter where you're gonna have all the contacts to be able to follow up on those initiatives you've seen today. Lexi, before concluding, I would love to have a very couple of takeaways you think our audience would like to leave us with. Just a couple, as we are running late, but I know that you have ideas.
Yeah, I think what came up time and time again from these really inspiring people was that, yes, we are facing unprecedented times. The onslaught on gender equality has never faced a battle like this, but there is still reason for hope. You know, the women are very resilient. They are coming together. They are forming savings groups. They are lobbying governments. They are doing the healthcare work that is so vital at the moment. So there is hope, and as long as we can make sure that those voices keep on being heard, then we have some reason for optimism.
Completely agree with you. Great. Well, thank you so much. I think we are a bit out of the time, but it's okay. Well, we had a lot of people all around the world listening to us. So thank you again. Thank you for your questions. Thank you, Lexi. Thank you very much for being with us this afternoon. Thank you, Sarah, Gary, Sybil, Julie, Nozi, Marc, and Hauwa for inspiring us. I want to thank you all, the Sparknews team you can't see behind the screens: Anissa, Flo, Camille, Teresa, Pinchwan, Oban, Sarah, Audrey. Well, all these people have been working for you guys to make this webinar nice for you to follow. I want to thank the Bill and Melinda Gates Foundation. And just for you to know, that's the next months, October, November, and December, we'll have new webinars. In October, it will be on the media, women in the media. November would be women in leadership. And in December, the women economic empowerment. So a lot of nice things to come. Once again, you'll have all this information about the dates and things on this newsletter you're going to receive. Well, I hope you had as much pleasure to follow this webinar that we had to put it up for you. Take care. And please, next time, don't hesitate to invite someone of another gender. We'll change things on the gender equality topics if we all join forces. So we need to be male and female to work on this. So please, that's an idea for the next seminar. And this webinar is to invite somebody of the next gender to come with you, listening to all these inspirational people, and maybe we'll make things happen. So once again, thank you again, and see you next month. Bye.
Thanks so much.